Okay, so this is DJ Dr. Chris.
And it's your favorite nurse practitioner, Bri.
Today I'll be talking about knee arthritis.
And I'll be talking about different types of stress.
And after that, we're going to open a bottle and see what comes out.
And guess what? We have a special guest joining us during the Poppin bottle session. And I'm excited.
I'm excited too. Let's get it started.
This is Poppin Bottles.
Okay, Bri, what's going on?
Nothing much.
All right, so today I'm talking about knee OA, knee arthritis. So you know I like to challenge the status quo, right?
Yes.
Okay. So what breaks down cartilage in your mind?
Age.
Age,
Wear
definitely.
and tear.
Wear and tear. That's the phrase I want to address because I think I have a problem with wear and tear.
Okay.
I want to call it sad and poor instead of wear and tear.
Sad and poor.
You're making a face. Okay, Wolff's Law, right? Wolff's Law states that the body adapts to stress applied or not applied, right? So the more stimulus you put into a tissue, whether it's bone, muscle, cartilage, the more it'll grow, right? This is how we address osteoporosis. The less you put into it, you get osteoporosis, right? That's why astronauts go off to space, come back with severe osteoporosis because they can't put stimulus to their joints. So why does it make sense that putting stimulus into cartilage will break it down?
Maybe not in the beginning, but towards the end. In my mind, so it's kind of like I feel anything in life. The more you wear it, the more you overuse it. The way if you don't treat your body and take supplements to help prevent certain situations, it's going to eventually fade out. So that's why I think the wear and tear comes in play for me.
Yeah, so I think so I'm calling it sad and poor. I'll get to the sad in a second. The poor, maybe like poor quantity, so way too much or way too little, or poor quality. So if you're running on a knee that's caved in, of course you're going to wear it down. So you have to have a stable structure first. So that's where the poor comes in. SAD stands for Standard American Diet, right? Okay, so one of the things we do know is chronic inflammation will wear down basically everything, including cartilage.
Yeah.
Right, so Standard American Diet is sugar, vegetable oils, fast food, processed foods. All these things chronically over time is going to beat up cartilage. So I'm calling it sad and poor.
Sad and poor. I can get along with that. I just don't really like sad though.
You like the wear and tear?
I like wear and tear, but sad and poor.
So there was a study came out this year. It was a 10-year longitudinal study, almost 1,200 participants. They looked at low-level activity, moderate-level activity, strenuous activity, like runners, and they found no correlation between knee arthritis and all this activity.
How long was the study?
10-year study.
Just 10 years.
Mm-hmm.
So if you think about it, when someone is legit 16, they're running, they're doing all this fun stuff, and then they're 26. I don't see a big difference between 16 and 26. Now, 26 to 36, I feel like things change. 36 to 46, things change. That's why I think age has something to do with the wear and tear as well. Because someone that may have not been as active as a runner or a basketball player or a football player, but they were still had a very fairly physical lifestyle, their knees and their shoulders are not as injured as someone who is more athletic, I feel like.
This is true. Of course, there's lots of variables, and these are the problems of studies. There's going to be tons of variables to look at, and it's hard to tease out everything. But there was another study came out, and I forget the numbers on it exactly, but it came out this year, I believe. And it looked at...
Fake news.
What's that?
Fake news.
No, it's not fake news. But it looked at a sedentary population over an extended period of time. And they found an increase compared to a placebo of degeneration in the lumbar spine and thoracic spine.
I agree with that.
Yeah.
I agree with that.
Right,
I'm focusing on knees and shoulders. But yes, I feel like if you're overweight, your lumbar spine is going to be extremely bad because you're not going to have good structure. And then I honestly tell my patients, if your back hurts, the worst thing you can do for it is to just like stay still. It causes more pain because if you're still, your body gets adjusted to feeling this way. You need to move. I'm not saying just do everything on your own. You should go see a physician, go to physical therapy. They know how to move your body in a certain way in order to prevent further injury. But the worst thing you could do is just lay down or sit down in a chair.
Yeah, we're built to move. But I feel like there's more to come on this topic. I think over time we're going to find out more and more that running doesn't destroy knees. Of course, if you can do anything with bad technique. But if you're running with decent technique, I don't think that's what's causing knee arthritis.
I'm interested to see what happens in the future. I am. Hopefully they keep you in business.
Absolutely. So what do you got going on? You want to talk about stress?
So when you're talking to your daily, was it daily? No, I think I want to change it. Last week I said daily. This week I'm going to say your weekly dose of Bri. We're going to talk about stress. Back to what you were saying, stress, it can be in many different forms. There's physical stress, there's mental stress, there is just like let me see. First, I'm getting ahead of myself. I'm going to define the different definitions of stress. The first definition of stress is pressure or tension exerted on the materials of objects. So that could be knees, shoulders, things like that. The other one is given a particular emphasis or importance to a point, statement, or idea. That's speech. That was the third one I was thinking of. And then a state of mental or emotional strain or tension resulting in adverse or very demanding circumstances. So there's different types of stress. Depending on your body, I feel like stress can be harmful. Some stress is okay, but not over a long period of time. It can cause different toxins, if it's emotional stress or physical stress, to develop in your body. And then you have to figure out a way to release it, or over time, it can wear you down. And so that's why I truly believe in like massage therapy, acupunctures, different teas. We talked about going running or just being outside or doing something active in your happy place, because it provides endorphins to develop, which then helps you go forth, release the stress, and all that isn't keeping in your body for a long period of time. I know next week we have someone fun coming on to talk about massage therapy and just how when they move your muscles and if you have any knots or tension in your body, it releases toxins into your bloodstream. So that's why every massage therapist tells you to drink water after the massage so you are able to pee all the toxins out. And I have one patient, I told her, I was doing trigger point injections. Trigger point injections are similar to like a massage, but it's a needle that goes into the muscle. It causes the muscle to spasm. And then at that point, toxins are released. So I told the patient, I was like, you should, which sounds a little crazy, look at your pee. I was like, look at your pee. I was like, because right now it may be yellow, light yellow, clear. Once you go home this evening, it will be dark yellow. And she came back the next week and was like, I thought you were joking, but it really was. It was a dark yellow color, and I had to drink a lot of water to kind of help flush everything out. And I was like, toxins are just like ridiculous, and they really can wear on your body over a period of time. I think like aging, I honestly feel like it has something to do with like dementia too, but there's not enough research shown to prove that yet, so that's a whole nother subject. But stress is not always good. I think we should put some stress on our bodies to keep us active and to keep us going, but not overly indulge in that.
There's the sweet spot.
Yeah, the happy medium. So what do you think about stress?
Well, when you were talking about that, it just reminded me of something. So I don't know about you, but when I get a massage, I get like super groggy afterwards. Does that happen to you?
Yes. I'm always so sleepy.
Sorry.
Okay, we'll cut it out. Your mom is in the bathroom, but we're recording something.
So yeah, I get super groggy after a massage, and I always attributed that to like some sort of parasympathetic nervous system response. But I wonder if the toxins play into that.
I think the toxins play into it. So one thing I've noticed, like there's a difference between just like a relaxation massage, a deep tissue massage, and then the myofascial trigger point injection massage. All three of those play different points of your brain stimulation and how you feel. Truly feel that if you have a lot of toxins in your system, because sometimes it's not that I just feel sleepy, I just feel like I don't. It's like my body doesn't feel the same way that when I went in, when I come out. So I feel like toxins have something to do with how you feel when you get out.
Yeah, I've definitely stimulated the sympathetic nervous system before with my patients.
Oh.
If I do like a joint manipulation, they'll just start dumping sweat on the table, and that's that vasovagal response.
Yes. I've had patients pass out on me before with trigger points because they'll be like, "Oh yeah, you hit the spot. You hit the spot." They get, I call it the zing, where it feels like lightning goes up into the head or down their shoulders, and then I'm like, "Oh yeah," and then 2 seconds later they're like, "I'm dizzy. Oh wait, I'm sweaty. Oh wait, I need to lay down."
Yeah.
And then I'm like, "This is normal.
Yeah.
It has happened before. Your body's just is not used to this sensation and it doesn't know what to do. It hits the vagal response.
Yeah.
You lay them down. They're totally fine afterwards." But then the next time they come in, usually they're fine because your body adapts to the situation.
Goes into that fight or flight mode.
It really does.
I have a buddy who passes out just in the sight of a needle. That's right, Jim. I'm looking at you.
Oh my gosh, poor Jim.
Yep.
All right, fans. I'm so excited for 2 reasons. The first is that we're about to pop a bottle and see what comes out. So this week, we are going to pop one of my favorite white wines called Gavi. So it's Gavi. It's a wine from Italy. I feel like it's a mix between like a Pinot Grigio and a Riesling. It's not too sweet, but it's not as like dry or like buttery as a Chardonnay. But if you can, I would look up this brand. Any of the brands are amazing. But this is one of my favorite white wines. So, what do you want to talk about today, Chris?
We have a guest today, Chris Edwards from TriCore Wellness.
Yay!
What's up, guys? How are you?
This guy is a beast, both literally and figuratively. So Chris is the owner of TriCore Wellness, as I mentioned. This is a really exciting company. He's got some cool stuff going on. Why don't you tell us a little bit about your company?
Awesome. Well, thanks for having me. I appreciate it, and to share, spread the knowledge, share the stories, and pop some bottles. I'm excited. So what we are, TriCore Wellness, is we're a unique type of business. We're a wellness management company that specializes in personalized health coaching, nutrition, and online training. So what we have done is basically put together a team of professionals that utilize technology, health data, and professional coaching to be able to really develop complete wellness plans for people. The word TriCore stems from the 3 core elements of wellness: fitness, nutrition, and recovery. And honestly, talking about stress and talking about, knee and arthritis and things like that, I mean, it all fits directly into what we do for how we manage our clients. The main demographic that we work with are working professionals. A lot of those working professionals may have been, athletic or fitness goers or former athletes. We work with a lot of current college, high school, and even pro athletes too. And really what we do with our personalized health coaching is metabolic efficiency and optimizing one's metabolic rate using fitness, nutrition, and recovery. We have a suite of apps that we use to connect with our clients. We have connected health devices that connect to our apps. So we're able to gather, all the data that comes through your watch, all the data that comes through your phone. We have a connected smart scale that measures your body fat, your BMI, your bone density, intracellular water levels. I mean, you name it. And then we have a team of clinical nutritionists too that can do blood work. They can look at your micronutrient deficiencies, your food sensitivities, and actually look at your red blood cell functional nutrition as well too, to really say, okay, hey, yeah, you may be in lab range, that's great, but you're still pre-diabetic. How do we get you to a functional nutrition range? How do we optimize your metabolic rate so you can have better success and better health and better performance for the rest of your life, whatever you're doing? In a nutshell, that's kind of what we do. And, I'm excited to talk more about this. And I have my wine now, so I'm excited.
Yes.
Cheers.
I was literally about I have questions. You really explained everything in a very concise little piece. So now my only question is, where do I sign up?
Awesome. Yeah, our website is www.tricorewellness.com and TRICORE wellness.com. Yeah, we have a website that talks about all of our information, describes the wellness management process, and basically, really what we do is we go through a 3-step process in our evaluation. Number one is we have an extensive evaluation form because we look at clinical nutrition. We have to look at some of those medical needs behind the scenes and really decide, okay, who is going to be the best person you work with? Do we need to bring in a physical therapist? Do we need to bring in a specialty nutritionist that's focused on food sensitivities? So that's the first step. Second step is then meeting with me as the managing director, and we have like an in-person interview. I get to know you. I want to know your coaching style so that way we can communicate with you the best. You may be best suited to work with another one of my coaches because you're going to click with that person better. Personalized health coaching and the research and the development of this business, we put a lot of work into this to really make sure that when somebody is working with another health coach, whether their background is in fitness or nutrition or physical therapy or whatever, we want to make sure that they're the right fit for that person. And then lastly is then developing their full wellness management plan. So then looking at all the services and products and everything that we offer and really customizing an approach to managing that person. So it's really a completely customizable, individualized approach to wellness. Even the blood chemistry and how we recommend our supplements and nutrition approach is individualized. Because of blood chemistry that we do, we're not necessarily giving a standardized protocol to supplementation. We find, hey, are you, better suited for this type of zinc rather than this type of zinc, and why? So we really try to take a next level focus with this, and we've had some tremendous success working with a lot of our clients right now. And, we're just excited to spread the word. And thank you again for having me here today, too, just so we can get the word out that this is something that's really been helping a lot of people. And whether you're a elderly, working professional, an athlete, young individual, doesn't matter. Metabolic enhancement can happen on any type of person, any person.
That was going to be my next question, because I know like some females are not always comfortable going to the gym because you see all these people, they're all fit, and you're kind of like, oh, I'm not so fit. I will go at this time or this time so I don't have to be around everyone. When we go in, would it be like you said, kind of one-on-one personal, but are there other people in the gym with us, or is it just us by ourselves with you, or is it just like this group is over here, this group is over here? Tell me more about your setup.
Awesome. Love it. So we actually don't have a gym. Yeah.
I was like, oh, wait a minute.
And you know
I can handle that.
No, it's cool. I mean, the reason why is because a lot of people want to work out in different capacities. They already have current memberships. Maybe they want to do it at home in privacy. And honestly, because of the virus and stuff and all of the concerns now, a lot of people are leaning more towards working out at home, in a different environment or a more secure environment. So what we've done is by using our app, and I can show you guys what the app looks like here today. But using our app, we program based upon what the person's needs are. And we basically put together complete programs that, have your periodization schedule, for your workouts. Let me just pull up somebody that has allowed me via HIPAA to show their information. Yeah, we have to stay HIPAA compliant as well too.
Yes.
So in his training phase, and hopefully we can get some good Wi-Fi here. The training phase is broken up, and you can see how we have his calorie and macronutrient breakdown. He follows this. He has different schedules for different types of workouts. So basically, I can design, and our coaches can design workouts for wherever they want to go. So if they are traveling to North Carolina, like this guy travels to North Carolina for 2 months of the year, I can design in-home programs for him. When he comes back, then I redesign the program for his neighborhood gym. All they need to do is basically take a video or some photos of the equipment that's in there, and we can program that.
We can make it work.
And we can make it work.
So we're in my living room currently doing this podcast. Yes, we are social distancing. However, we actually get to see each other's faces because in the last couple of episodes, we have been on Zoom calls. So my living room, my space, what could I do? I'm putting you on the test right now. What could I do in here if I don't have any weights? I'm just newly starting out. I'm like, I need to lose about 5-10 pounds. I'm nervous about joining the gym because I don't want to waste any money. So just being in my living room, what could I do?
First thing is we're gonna look at the complete approach. So we're gonna ask questions about your nutrition, about your stress, about your recovery, because that is also gonna have a determining factor on how we position your fitness. So fitness is basically self-induced stress. So to be able to really position a proper fitness program, we need to know a lot about the other information, including your recovery rate, maybe even your blood chemistry, how you are handling your nutrition, where your calories are at. Because we have a lot of times that people will come into us and they'll say, hey, I need a really tough, intense workout program.
Yeah.
And I'm looking at them, I see some signs in their body, I see some, stressor signals and stuff. And they may not be best suited for a high intensity workout program if they're trying to lose weight. And like Chris was saying before too, their sympathetic nervous system may be so high and stressed out. If I come in with a high intensity HIIT session, that's going to push them further away from their goals.
Oh, geez.
Or I may even recommend, look, if this person's stressed out, I'm going to say, look, you may need just some light body weight movements and some deep breathing and a couple yoga sessions a week. And as they drop into that parasympathetic state, because maybe they have a high stress job, maybe they have really high cholesterol, maybe they're on the high end of their blood pressure.
Yeah.
Those things are going to start to drop down. Their metabolic efficiency is going to work better, and they're actually going to lose weight by doing less. So it's hard to say, but it really depends. But if you have just an open area, some couches, we can really design anything anywhere. So
I was like, you just told me why I'm not losing weight. I'm stressed. It's not me. It's just the stress in my life.
Like, this is so typical of Americans. We're so good at revving up, right?
Yep.
Yeah.
Energy drinks, Starbucks every corner, work 9 to 7,
Be alive.
right? And when was the last time you just sat down and just concentrated on your breathing? Or just relax. We're just so go, 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 go.
Wine without wine. Because with wine, I can usually...
It's moderation.
Yeah.
It's all moderation.
It's kind of normal.
But wine's like a blunt instrument. It's not truly turning down. It's fun, don't get me wrong, but we're not good at ramping down.
Mm-hmm. It is hard. You have life. Life gets in the way of a lot of things. You have 2 kids, Chris.
Uh-huh.
2 children at home. That to me is already stressful, and I don't even have children. I have a dog, and she's stressing me out right now. So I can see how people put on weight, and it's really hard for them to lose weight, and then they get discouraged. So your program sounds amazing to me.
Thank you.
Because if someone said, you might just need to breathe and you may lose a pound, I'm like, oh, hell yeah. Sign me up.
Yeah.
Well, here's the cool thing, too. He's got this upper level tier personalized fitness where there's accountability. Right, so you'll take a picture of your breakfast, text it to him, and he says, "Okay, it's this many calories. Here's the breakdown. Slow down the carbs, or whatever it may be." And so all your meals for the day, he's coaching on what you need to do.
Now, is all that included in the package, or is it
Depends on the package, right?
Okay.
Yeah, it depends. Yeah, we have they're called signature programs, so they're kind of package programs for build or trim, or we have one that's called executive health that is looking at all of the different blood tests that we do. We have a surgical and sports injury program that's geared towards people going pre-op, post-op surgery. Maybe they had a sports injury. How do we speed the healing process? So we have different packages like that. But really, when it comes down to the individualized approach of wellness management, is you're going to have a membership with us, and we have 3 tiers. Online coaching, which is basically we're checking on your nutrition and body stats, and you're pretty self-sustainable on your own fitness. Online training, which is we're nutrition and body stats, and then we're bringing in the fitness component on our app, so you're following our programs. And then the last one, what Dr. Chris was talking about, was private wellness. So private wellness is basically a daily texting service, a daily concierge texting service with your coach. So the coach may be focusing on you this month on, energy balance, which is trying to find the right calorie rate. Next month, it could be, whatever they decide. And we try to take it slow and steady. So what we're doing is developing habits on a daily basis. So the key with success in health, wellness, life, essentially, is developing long-term habits.
Yeah.
And our signature program of private wellness is habit-focused to the point where we are guiding you on a daily basis, based upon your evaluation and how you receive coaching, how we are going to break bad habits, or not bad, but maybe not so good habits that are pushing you away from your goal, and instill new healthy habits that are going to get you closer to your goal. And the private wellness program is hands down our most popular. It is our most expensive because it's daily communication.
Yeah.
So the coach has to be, compensated for that, but it's the most successful at the same time because it's the daily communication.
Yeah. But then, like, I can sign up for private wellness at first.
Yeah.
And then as I lose weight and maybe hit my goal weight, I can go to a different tier.
Exactly.
Yeah.
And there's no commitments. You're not locked into any contracts.
I love that. No contracts.
So yeah, no contracts. It's just month to month. And if you have a great month and you say, hey, you know what, I wanna take a step back. Let's just go from daily texting. Let's go to online training and drop down a membership. No problem.
Yep.
And we actually have some people that kind of go back and forth. Some people may have a good routine, and we have a lot of seasonal clients,
yes.
Being here down in South Florida. They may say, hey, I need this at this time of the year because it's bad influences and we're going out and we're drinking and we're eating out in restaurants and, whatever. And then they have certain times of the year where they're more self-sustainable. They can control themselves better. So, really we're, as their health coach, as their personalized health coach, we're working with them through those changes in lifestyle. We kind of parallel that, and I come from the fitness and athletic community, so I look at things in blocks of time, periodization, right? So I even look about it as like an athlete, right? They have an off season, they have an on season, they have a preseason, and they have postseason, and our lives are the same way. We have summertime, we have spring, we have winter. When I look at my clients and we're looking at how to manage people during the holiday season, it's a completely different look than after January 1, because their focus is different.
Yep.
And you can even think about it as those are your periodization blocks where we're going to program you differently from October to December 31st than you are January 1st to March 31st.
Yeah.
Summertime, maybe you're traveling, you're going to Europe, and hey, we need to stay in contact because I don't know what's going to happen. I still want to stay on track. I don't want to gain 15 pounds on my trip to Italy this summer.
Exactly.
So with Wi-Fi and capabilities of what we have now using technology, we can do that. And we've had, 24 of those situations happen over the last couple of years. And people come back, they're back on track, and they're hitting their goals because of that accountability and the communication that we have now. It's really cool.
Awesome stuff.
This sounds like a great...
Are you ready to sign up?
Yeah, I really am like, oh.
They even do like a personalized shopping trip. They teach you how to shop right.
No, I don't agree with that. It's like, that's a little too far.
Well, tell Bri about the patient you were telling me about that you were able to get off of 3 different beds.
Oh man, yeah, that was a great success. So we actually try to establish relationships with doctors, orthopedic surgeons, concierge doctors, things of those nature, because a lot of those patients have challenging situations. Mm-hmm. So one of the guys came in. It was a referral from one of our concierge doctors. Excuse me. He was 3 or 4 different medications, blood pressure, blood sugar, and really had a challenging time. Thought he was eating right, working professional, business owner, own a construction company, high stress job. Yeah. He was eating out all the time. He was not as necessarily aware of his calorie intake, wasn't hydrating properly, and talking about inflammation like we talked about. Like he was having all of those stressors and those inflammatory markers that you guys just talked about.
Yeah.
So really in about, I want to say 3 months, we were able to get, I can't say this. We can't claim that we can take you off medications. That's on your physician.
Yes.
You got to make that decision with your physician. What we can claim is that we're going to make you healthier, and then you and your physician can make that decision together. So that's what we did. So we made the person healthier by optimizing his metabolic rate, rehydrating him, getting him back into a proper fitness regimen for what he needed. 3 medications, I think it was 3 or 4 medications gone. It was 30 pounds. I mean, it was unbelievable. It was unbelievable. And then he told all of his friends. So now all of his friends signed up. His son, his wife signed up. I mean, the whole family signed up, and they're all having phenomenal success. And again, just looking at each of the individual person and optimizing each person's metabolic rate, that's the key. That is the key.
It really is the key, because I was looking at something else and I was like, the workout I would do would not necessarily be the best workout for DJ Dr. Chris or my friend Kimberly, because she is 5'4" and 120 pounds. I'm 5'10", and I won't tell you how much I weigh, but it's everything depends on the person, the body, how fast their metabolism, how slow their metabolism is, the stressors in their life. So not one workout is going to be perfect for everyone. So this sounds like an amazing concept, and I really am almost ready to join. I was like, because I have a wedding. I was like, I'm trying to lose about 20 more pounds.
One of the exciting things for me at my end as a physical therapist is what you talked about with the pre-op, post-op stuff. Because we get a lot of questions from patients like, I just had a rotator cuff repaired. What should I be eating? And a lot of physical therapists are well trained in food, but not everyone. And I don't think we do a great job as PTs personally at really educating people on what to be eating. So this stuff, and I love that you said pre-op too, is super important. I think it really can maximize results. And I think this is the way the medical model needs to go, is more proactive rather than reactive.
I totally agree.
Yeah.
Yeah, absolutely. It's funny you say that. We just had a social media post, and we try to provide education, to our members and clients and prospective clients as much as we can, about the benefits of going into a surgery in a better health state, and making sure, we've done this working with several orthopedics, and locally in town here, but getting someone to go into it at a healthier state so they can recover faster post-op. Whether it is a rotator or a hip or a knee or whatever, having a faster and a healthier metabolic state you're going to recover faster. There's definitely risks going into it in a more compromised state. From everything from blood pressure to even blood sugar, and say you have a lower muscle mass, lower muscle density, you're going to have some atrophy coming out of a major surgery too. So, if you can gain some muscle density going into it, you can kind of prevent the loss coming out of it as well.
Yeah.
So
some of the best outcomes with knee replacements I see down here are the people that do prehab, that go in for therapy before surgery. They have the easiest recoveries. And that's only looking at the physical therapy point. We haven't even added in the nutritional stuff.
Yeah.
So, why not throw that all together and just truly maximize results?
Yep. No, it's been very successful. And having that recovery component of the business and really essentially bringing that to light. I feel that, back in the 80s and 90s, fitness was really got going and really took a hold into, society. I feel like since 2000 to maybe now, like nutrition has been a really big focus. Obviously, there's been some good things and bad things through that. Some of we won't go there, but there's some really good diets and
I've
really
been on every one of them.
Yeah, there's good and bad ones. But I feel like now, it's kind of like everybody's being more aware of their recovery, their stress. You're seeing a lot of devices now that are tracking your sleep. You see a lot of things that are promoting and businesses opening up that are doing cryotherapy and compression therapy. And all of those are recovery techniques for minimizing physical, mental, and emotional stress. And, I feel like in the next 20, 30 years, we're going to see recovery really being a big focus in the industry. And, I'm just glad that we've kind of embraced it already and are trying to educate people on that. So.
You're the head of the game.
Got to do it. Yeah.
Exciting stuff.
Well, thank you so much for joining us. I learned so much, and I really am excited about this.
Thank you.
You're going to hear from me. Can you give us the website one more time?
Yes. www.TriCoreWellness.com. And we have a contact us, section at the bottom of our homepage there. Feel free to check around, and we have a blog on there, and we have frequently asked questions. So if you have any questions, information, check it out. Contact us. www.TriCoreWellness.com.
Perfect. So this is it for us today. Chris and I are so excited to be together again. I get to see his little sweet face. So, yay.
My sweet bearded face.
But join us next week for another episode. We will be continuing to talk, in my area, we'll continue to talk about stress, and then I will introduce our special guest, a massage therapist that's a close friend of the both of ours. And then we will go from there. Have more games, more wine, and just more fun and talks.
Yeah, we'll be testing our wine knowledge again soon.
Yes.
Just last week was a little bit poor.
It'll probably be bad again. I just know stuff tastes good.
All right, this is DJ Dr. Chris.
And your favorite nurse practitioner, Bri.
This is Poppin Bottles.
Bye.